Good morning, students. The next topic we are going to discuss in the chapter torch infections is syphilis in pregnancy. Syphilis in pregnancy. All we know about this condition, syphilis. Syphilis is a sexually transmitted disease caused by the bacterium Trypanosoma pallidum. And this disease is characterized by four stages, and the signs and symptoms of syphilis vary depends on the stages of this condition. And the four stages are primary, secondary, latent, and tertiary stages. There is a latent stage between secondary stage and tertiary stage. Therefore, altogether four stages. The primary stage of syphilis is characterized by a lesion that is called chancre. It is a firm, painless, non-itchy lesion, mainly seen in genital organ, anal region, and mouth. The name of the lesion is chancre, and the characteristic feature of chancre is painless, non-itchy with a raised margin. That is the peculiarity of this lesion. Primary lesion of syphilis is known as chancre. This stage is followed by the secondary syphilis. During secondary syphilis, there will be diffuse rash all over the body, mainly on palms and soles. There is symmetrical non-itchy rash on the trunk and extremities. The secondary stage is followed by the latent syphilis, the third stage. Latent syphilis lasts for years. During this time, there will be few symptoms or no symptoms at all, but serologically positive. If we do the serological test during this period, the patient shows the positive result. This is followed by the fourth stage. Fourth stage is called tertiary syphilis. Tertiary syphilis is characterized by gammas, soft and non-cancerous growth on body. It is also characterized by neurological problems and heart symptoms. Transmission is mainly sexual contact. It is a sexually transmitted disease. It may also transmitted from mother to baby during pregnancy or at birth. And this transmission will result either in abortion or premature labor or stillbirth or a newborn with a congenital syphilis. The effect of syphilis on pregnancy depends on the time of infection. It is more severe. The effect is more severe when the disease is transmitted during primary stage and secondary stage, and the severity become less if it transmit during latent stage and tertiary stage. Now, what are the effect of syphilis on pregnancy? We have seen that it causes abortion, and the peculiarity of abortion is the second trimester abortion. The main cause of second trimester abortion is syphilis. First trimester abortion is not common in syphilis. The other effects are premature labor, placental pathology. Placental pathology involves placenta become large, pale, and bulky. Or it may either result in stillbirth or a newborn baby with a congenital syphilis. Congenital syphilis occurs when a child is born to a mother with active syphilis. Some infants with congenital syphilis have symptoms at birth itself, but many children develop the symptoms in later life. Baby exposed in utero can have deformities and growth developmental delay. Let us see the clinical features of congenital syphilis. It involves a large abdomen with hepatosplenomegaly. Both the liver and spleen become enlarged, and there will be edema, ascites with hydropic features. Edema, ascites, and hydropic features. There will be sniffles with rhinitis, and another peculiar feature of congenital syphilis is Hutchinson's teeth. Hutchinson's teeth means smaller teeth, smaller, more widely spaced teeth with notches. You can see the picture of Hutchinson teeth here. And there will be jaundice with petechiae or purpuric skin lashes, skin lesion. Diagnosis is by VDRL test. In India, all pregnant women should be screened for syphilis and VDRL test is done routinely in all pregnant ladies in the first trimester itself. And if the VDRL test is positive, confirmation test is by FTAABS, that is a fluorescent tripanormal antibody absorption test. Management, early detection and specific treatment. Early detection is possible by the easily available test, and if we treat the patient at the earlier stages, the result will be more good. And the public should be educated about sexually transmitted diseases and the preventive measures to avoid the spread of sexually transmitted diseases. Thank you.